Hello, and welcome to episode number 4 of the Past Your Prime podcast. My name's Alex. I am a professional volleyball player in the Volleyball League of America. This is Craig. He's a doctor of physical therapy. I also have a great voice. Say something, Craig.
Hi, I'm Craig. I also have a good voice.
Alrighty. Any more accolades that you want to share?
Physical therapist. I enjoy working through different patients' problems, pathologies. Feel like I fumbled that one a little bit, but I like working with patients.
Problem pathologies. Problem pathologies.
Yeah, problem pathologies. I like the alliteration. Oh, my Lord.
All right.
That's
Do we
good.
want to do a quick injury update?
Sure.
You were dealing with some upper back earlier
Oh, yeah.
and some ankle issues. How are those doing?
The ankle is still completely better. I have not had another close run-in with a driver who wanted to murder me by flashing their brights and swerving toward me. So that's pretty nice. As long as I can avoid that in the new year, I think I'll be solid. Yeah, I've been having a lot of neck issues, though.
It's the new year. Happy New Year.
Thank you.
All right.
You too. Happy New Year.
What's wrong with your neck?
Well, I've been doing a lot of heavy shoulder pressing, a lot more than normal. Doing some Olympic lifts that I think also may have triggered it. I'm not great at the Olympic lifts. I did a lot of it when I was younger, back in the college days with football, but I have not done a ton of it since then. And one of my trainers here at Smith Performance Center, they are really good at coaching it. And so gave me some pointers. I've been working through some of those along with some overhead squats. And that combined, I think, with sitting a little bit more than what I normally do has really helped to irritate the piss out of my neck. Yeah.
The piss. All right.
Yeah. How about yours?
My neck is
Yeah.
now.
No pissing.
No piss on my
good.
neck. My hip is still pretty angry. But speaking of Olympic lifts, like that's something I really want to get back into once my wrist can handle it. We'll see. I'm hopefully starting a new program with Craig, maybe even today.
We're starting today. There's no hope on that.
Okay.
We're starting that today. So
yeah. So just to see how far we can push my athletic performance, I'm hoping to spike some volleyballs in a couple of weeks, but my hip is limiting me pretty big right now. So we've got a diagnosis on that, but I think we just want to kind of double check it and make sure that we're on track to be able to get back to jumping here in a couple of weeks. And then my wrist is still progressing every day. So working hard at it just to try and get the extension so that I can get a nice hard snap.
Did you say you're hitting in 2 weeks?
That's my goal.
Goal is to spike in 2 weeks.
Yep.
Have you had any contact with it? You volleyed or anything like that?
I mean, I've got like my daughter has a kids volleyball that I hit against the garage a couple of times, and a month ago that didn't feel good. This past weekend it didn't feel bad. So I'm making progress.
I always think it's interesting when you have an injury where it makes all the tissues around it more tender, more painful, even though that's not the part that was actually hurt.
Yeah. Yeah. And I don't think you can feel bones. So the bone doesn't hurt.
Oh, no, bone can be
you can feel
painful.
Oh,
yeah.
Okay. All right. Well, I'm not a doctor, but
well, so yeah, you've ever been around somebody who has a bone stress injury or
my mother had a trimacular. She broke all the bones in her ankle, all of them.
Trimalleolar fracture.
There we go.
I thought you were gonna say like macular degeneration, and my brain that's not close to the same spot. No, so bone is exquisitely painful. But we call it secondary chronic hyperalgesia or secondary hyperalgesia. And what can happen is your body will start to trigger the nerves that lead into your brain that cause pain.
Oh, okay. And I had some nerve issues in my wrist. So that makes sense.
Feels more exquisitely tender. And as you start to desensitize, that should go away.
All righty.
Yeah, which is pretty cool. So we'll give you an update on that. And when I get done working them out today, we'll see how the hip looks.
Yeah. Well, don't look at it too closely. That would be weird. Anyway.
I will be all up in his business looking at it.
So today for episode 4, slightly related to bones, maybe. I don't know. I'm not a doctor. But we will be talking about how to train with low back pain. And so I feel like pretty much everybody I know that's within our age bracket gets up and, oh, my back, my back hurts. Like you were just on the toilet. You shouldn't be dealing with this much pain from just getting up
Sitting
the
there
toilet.
for 5 minutes and
so
hurts.
yeah, like why does it seem like, everybody in their 30s and 40s seems to be dealing with low back pain?
Why is that?
Yeah.
Well, we talked about it a little bit last time, where our spine is really mobile compared to if you compare us to other primates and how their spine is used, and that predisposes us to different types of lumbar pathologies. But one of the big issues, kind of talking about getting off the toilet, is that your back is loaded all the way throughout the day. So the whole idea that you're not unloading it, you're unloading it when you sit down versus when you're standing up versus when you're doing activity, all of those things load your back. So the only time you really ever get out of loading your spine is when you lay down. Whereas there's no other structure outside of the spine that's like that. And so knowing our day-to-day activities and how most people grind the whole day, you wake up, you immediately start to go through your day, you go to work, you sit down or you stand. So, I mean, I know there's the craze around standing desk. You're still loading your spine when you stand. It's not different.
So is it better to sit or to stand?
It depends on what is going on with your back.
Oh, okay.
Right. So if you have an extension intolerance in your back, meaning like you can't extend your spine, standing in perfect posture will make you worse. Whereas if you tolerate flexion a little bit more, you might find that flexion's more provocative, sitting may be more painful. So it just depends on which positions and things that hurt you, and it typically depends on what structure is actually involved that then causes you to have more symptoms. So there's no ironclad rule.
All right. I personally just try to switch it up every couple of hours during the day, and it just makes me feel better about myself. So,
well, you should feel. I like that gives you like a self-esteem bump that we want.
Some joy.
I love it. Yeah, so everybody feels it because we're predisposed to having it, and then our day-to-day activities predispose us to it. I think we have a culture in America, obviously, where it's mostly work and work all day. You don't get out of gravity. You don't lay down. I mean, we talked about the first day where I said one of the things when he's had symptoms before is I told him to lay down a few times. And then you said...
that would be weird.
Yeah. Did you end up laying down?
No.
I see. I had a vision that you were,
I might have one time when like nobody was in the office and like, I'm gonna lay down for 5 minutes to see if anybody catches me, but no. Generally,
did you lock the door?
No.
Okay.
No.
That would have made it seem more weird.
Right.
Like they hear you like moving around, trying to get up, unlock the door. What were you doing?
Just having a lay. Sounds even worse.
Sounds way worse.
Oh, goodness.
Okay. So I think those are reasons why, though, is there's a large interaction between your daily activities and then people who, at the end of the day or before the day, whichever one is how you work out, there's a strong interaction between the activities you do and then your daily requirements for doing your work. And it leads to people, they're predisposed to it, and then they have an inciting event sometime throughout their life. Maybe it's when they're younger, they hurt their back lifting something up in the ground. Maybe it's when they're, trying to spike a volleyball or lift a heavy weight from the ground, and they really hurt their back one time, and then that tissue stays susceptible to injury the rest of your life.
Yeah. One of my teammates blew his back out just warming up. Got his back blown out. Which one of those is
it
worse?
always
trying to make it sound worse. Yeah.
So how did that happen?
I have no clue, but I got to play because he got hurt. So
it's one of those where you feel bad for him in the moment, but you're also.
But then I was dying.
Oh, you weren't ready to play?
No, because I was just like, oh, okay. I was getting ready to keep the bench extremely warm.
Was it so? Did it just hurt him, or did he?
Yeah,
was he done playing?
He was done.
Whoa.
He couldn't stand up straight for the next like 12 hours. But we got VIP through security on the airlines, which was, I guess.
So he was getting like wheelchaired.
Yeah, we wheelchaired him out of there. Yeah.
Okay.
Yeah, we took lots of.
Is he still playing?
Oh yeah.
Oh, he's dating.
Yeah, yeah, he's a beast.
Okay. Well, and so I think that's the reason why, though, and there's so many different causes for it. And the other thing about low back, which me and you were talking about before we started, there's such strong disagreement on diagnostics around the low back, depending on what type of provider you see. But even different professions will have different ways that they think about diagnosing. So there's those pieces that make it more difficult. You have a high risk for recurrence. You have mismatch between, like we said, the spine and what our daily activities are now. The location of the symptoms. So we think of low back pain, and when I think of it, possibly versus when you think of it, I think of it not just the back, but have you ever had anybody who talked with you where it's more like they have glute pain?
Yeah.
Right. And people will think it's a hamstring injury when it's actually a low back referral. So then they stretch the crap out of it, actually make it feel worse all the time, thinking they're helping it, but they actually make it worse. So it's one of them where the feedback loop is typically not easy to find. So you have all these different problems that are really common with this issue that then lead it to persist and never actually go away.
Okay. So what would you say are like the common reasons? And this is probably a hard question to answer, but like, what are the common issues, or I don't know what doctor word to use. Like why are people having the common reasons why people are having low back pain?
Low back pain. Well, so you have the mechanism where you get, right? So the first time that you actually have it where it's beyond just this nagging, aching pain.
Like an acute injury.
You have an acute injury, okay. Right? And it's kind of interesting. Like if you think of the lumbar spine, right? And to describe it, you have the disc, and then the disc has an outer layer that's called the annulus fibrosus, and then the inside is called the nucleus pulposus. So
I'm not going to repeat any of it.
You don't need to know that, but the outer portion is basically a ligament. So the disc is a specialized ligament, and on the top and the bottom of the disc, you have what's called a vertebral end plate. The vertebral end plate can fracture, and then you get blood into the disc.
And now, is that like a major injury? That's when you hear fracture, that seems like a major injury. That doesn't seem like it just hurts when I get up off the toilet.
Yeah.
So that's is it common to fracture your vestibular velocia?
Yeah. So, well, honestly, the vertebral end plate in some ways is more vulnerable to injury than what the disc is. But once that fracture happens, which can be just sharp pain and then not really painful, you get a blood, which is not normally, because the disc is avascular, I mean, it has no blood supply. And so when you get blood into it, your body actually doesn't like that, and it'll degrade the disc. So, when somebody says it, we call them a Schmorl's node once they fix, like once they heal. And it's basically a sign that you've already started the degradation pathway. And so once you started to degrade the disc, it's not going to handle load in the same way. And then you can have other further injuries. And this is without even considering somebody who has like just a massive disc blowout. Yeah. And those are, we have like prolapse, protrusion, extrusion. So there's these different types of disc injuries where those are the ones that you hear about where people have to go get surgery immediately. They have an extrusion. Well, that means that it's pushed into the past the annulus fibrosus, the outer ligament. And now you have an issue. You can sometimes, well, to be honest, even in those cases, I've had people where they don't need, a lot of cases where they haven't had to have surgery, but then you'll get like the nervy signs where we call them radicular signs down the leg, numbness, tingling, muscle wasting, which sounds terrible.
So is that the most common low back injury?
No. To me, the most common low back injury is I think that process happens in everybody though. So the human body is predisposed to having some level of degeneration to the spine, right? Like, and what will often happen is people will get imaging and then they're surprised. Well, I got told my spine looks like an 80-year-old person's, right?
Okay.
I think I don't think that's useful to hear. But that's a normal problem.
Nobody's happy when they hear that unless they are an 80-year-old man.
Yeah. It just pathologizes people in a way that makes them think that they now can never have a healthy spine. But like those large disc injuries are way more, they're very common in people who have young, healthy discs, because that's when the disc is most prone to have that happen before the inside part has become more fibrotic.
So is it more often that it's, I guess, like a bone or a disc versus muscular?
It's a good question. It's very typical for it to be both, right? So, and when somebody's had recurring low back pain, there could be an underlying disc pathology or facet irritation, depending on how this is one of the areas where people may disagree on what the actual tissue is that's causing the pain. And I mean, it's not clear. It's one of those things where it can be It can be both. It can be multiple things. But over time, if you have that injury and you have this recurrence, the muscles that surround the low back, they actually start to get fatty infiltration. They have a marbling of the muscle.
Why go back?
Yeah, you go like so for like in a nuclear apocalypse, you want those are the people you're going to want to eat because they have like probably the most tasty flesh.
That's disgusting. We might have to.
Yeah, we probably will. So, but anyway, so what happens is the muscle will actually start to have this kind of fattiness to it. It just means it's like a very unhealthy muscle. That can become painful, becomes fibrotic. But then, say it's like in an acute injury, you can get muscle spasms, trigger points, and those are all things we call myogenic. But you can have muscle that produces the pain. There's also ligaments that surround and stabilize the spine. Those can become pain generators. Basically, every structure that's around the spine can actually cause pain.
Okay.
So there's numerous structures, and that's not even mentioning the nerve roots that pass out or the nerves that supply those structures. So all of those things can contribute to your symptoms.
Got it. Okay. So how do you distinguish between, maybe something that's minor or something that's a full blown out back?
Yeah, that's a good question because just as an example, when somebody comes in, we often don't immediately go for imaging, right? That what we think of is let's reel off some red flags. Do you have radicular signs that go past multiple nerve roots, which would be a red flag, which just means that it's
Like you're radiating down your legs or it's going up, or
what we were talking before around red flags. Like if you can't control your bowel bladder, remember that's a huge issue. That's a cauda-equina syndrome. You don't
want that.
Yeah, we want to immediately get that handled. But what's interesting is the relationship between pain and the imaging is not that strong. So you can have somebody who has debilitating low back pain and they can have a totally normal image that shows no structural changes. So it's really hard to gauge off of the pain. What I like to look for instead is to see how easily the person responds to treatments. And so say we roll out red flags. After we roll out red flags, then we apply treatment to hopefully improve whatever type of problem they're dealing with. So let's say we think it's a disc injury. We can do lumbar traction. We can follow that up.
Which is pulling on it.
Which is pulling on it lightly. Yeah, no, so don't hurt it. We could do soft tissue massage to the muscles if we think that's a piece of it that's causing the pain. We can do cross friction to other structures around the spine that seem to make it feel better. We can do things like we call VPAC, volitional preemptive abdominal contraction.
Oh, I remember those.
VPAC makes us sound smart because of all the words in there.
Right.
But you have two different types. You have the drawing in maneuver, which can get the transverse abdominis, which is the deepest of the core muscles, along with the multifidus in the back to fire well. Because oftentimes when you have pain,
it's like flexing your lower abs is how I remember.
Oh, that's so interesting. Well, it's because they're really like the front of your ab. When you say lower abs, what's that?
I don't know. Like
this part.
Yeah.
Well, so it's a good point. I guess I always say because it's not, it starts, well, it's almost like a corset around the whole core, right? In that deep area, like if somebody comes in and they've had chronic recurrent low back pain, they typically present with one of two ways. They either have a inability to fire that muscle, right? And those are the people where it seems like any small move, all of a sudden they'll hurt. The other one that we see is people have what's called we call the high threshold pattern, where they throw everything at it and they're constantly braced. But anytime, if you think about this, anytime you fire a muscle that crosses a joint, it also compresses the joint. So if you're firing your core muscles as hard as you can all the time, that in itself can actually be a provoker of your symptoms.
I just remember the VPAC because that was super helpful when I was dealing with my low back back in the day.
Well, because most people don't actually have core weakness. That's where you hear this all the time. You need to develop your core. You need to develop your core. Well, oftentimes it's actually a coordination issue.
Yeah, just turning the muscle.
Turn the muscle on.
Yeah.
And then using it enough that you don't, there's no other body part that we talk about where we don't have a consideration of having enough to do the movement that you want, not more. I don't feel like I said that well, but it's the whole idea. I think we get taught oftentimes with the training methodology to get the muscles to fire as hard as you possibly can, where I think that's nonsense. It makes no sense to have the muscle on as hard as you can at all.
You want the muscle to feel good.
You want the muscle to feel good. You want it to be turned on. You can have relative stiffness, so making sure that the hips motion is good and you're not driving uncontrolled motion through your lumbar spine. You also want your thoracic spine to be mobile. Those two are the most common ones, but I mean, it can go above and below even farther. They can call it a regional influence where you can irritate stuff without realizing it.
Okay.
Yeah. So a whole bunch of stuff can make it feel better, even if it's just a disc injury. You have almost an endless number of ways to attack it.
Well, let's talk about those a little bit. So we've talked about you can't prevent injuries, but like kind of what would the strategies be for reducing the risk of either low back injury or low back pain?
Well, I mean, that's a good question. The way I look at it is once you've had the injury, now the idea, once you've had an injury where it's, how did we describe it before with injury where we'd said, we decided that
limits your activity.
So that's our qualification for it being injury. Once that happens, to me, the rest of your life, you're at greater risk forever compared to you before that happened.
You shouldn't have messed up that one time.
At one time,
ruined your life.
So
you will never stand up straight again.
Yeah. I just want you to know, that's irreparable. No, but once that happens, you need to be able to manage those symptoms really well and expect that they're going to come back. So that for us, that's a home plan focus, and not everybody has the same type of response, like the same positive response. But say that once that happens, what's the best thing that you could do? Well, it's figuring out what things actually make it feel better today. So developing a really clean home plan that makes you feel better. So for example, I have a recurring disc injury in my low back. And
never going away.
It always comes back.
Going away.
It always circles back. And so it's funny, my two big triggers are heavy lifting session that followed a long time of sitting. So if I sit, one of my things, I like to do like my writing or my work first thing in the morning. So I wake up really early and I typically drop right into doing that work. And if I have any level of irritation, I wear a lumbar brace while I'm doing the sitting activity. And then during the lifting activity, I always use a key sign, because even if I'm not having symptoms, we call it a key sign, which is something that will give you a better feedback loop. And so my key sign is touching my toes. So if I reach down and it feels no symptoms, it doesn't feel tight or anything. And as I start to lift and I try to touch my toes again, if it starts to feel tighter, I know I'm irritating my back. So it's knowing that I have these underlying feedback loops that I could dig into. And then I traction my back throughout the workout till it goes away.
Yeah. When I had my low back injury, which I feel like hasn't really presented itself, maybe through some of my calf issues more recently, but traction every morning was like the one thing. If I just woke up, kind of had a slow get up and then went to traction, that usually kind of helped me quite a bit, along with the VPAC exercises that we did previously.
Perfect.
So kind of getting into training, how can you modify your training if you're having low back pain or back pain in general?
Good. So I think there's two things. So the first one is to know where you're at, like which problem you're addressing. I think today it's a little bit outside of our scope of what we want to dive into, which is just really knowing that you have the right diagnosis. We can circle back to this. I think we had said, if you have low back pain and you want us to dive into how you diagnose it, you should comment.
Yeah.
And let us know. Yeah.
And 100% of you should comment, because everybody's back hurts. It's just, we've already discussed it in this podcast, but yeah, just drop a comment below. Tell us what kind of low back pain you're having, and maybe we'll get back and circle back and try and help remotely diagnose.
Yeah. We can use you guys.
I won't be worth anything there.
I would love to walk through on our team. Working through case reviews, I think, is one of the most useful things that our team really likes to do. I think it's one of the things that separates good clinicians. And so we will absolutely dive into your issue if you comment. So if you want to. So, but I think it's those two things. So we're not going to get into the diagnosis. So the two things would be, number one, are your symptoms stabilized with what your daily activity is? For us, that would indicate that you have a good working home plan and you're able to own your own problem. Second one, which is I think the biggest issue with low back injuries, is how do you progress your activity and progress your tissue capacity, when most often your exercise capacity is going to be higher than what your tissue can handle. And it's that separation between the two where I think people, they get stuck into this kind of injury hell that they keep getting hurt and then they build back up, they get hurt again, and they keep swinging back through this loop. And really, every time they do it, it's almost like they become more vulnerable for having another injury. The same
Sounds like the life of an athlete.
So I don't think, I actually think most athletes, this is their biggest issue, is that they are athletic enough that they can work around a diminishing tissue capacity. And that's where you get these recurring injuries. So like ankle sprains. It's so interesting how many people who've sprained their ankle, they have a functional ankle instability that they've never addressed. Right. So you'll I'll have pro athletes who can't balance on a single leg for more than 2 to 3 seconds, but they're able to do some of the most incredible athletic stuff. And it's because that's a difference. And so they get exposed. So say they, for some reason, can't look for a few seconds. And then that's when they tweak their ankle.
That makes so much sense. So, and I've been training with Craig for 10 years, and single leg balance has been in every warm up you've ever prescribed me. And now I know why.
That's why.
Because you don't want me to have ankle instability.
One that's covering some of the foundational pieces. So with low back injuries, there's really common problems that happen. So if we kind of work through it again, you have a tissue issue that never actually gets better. So you don't have a tool that makes the tissue itself feel better. You don't have a good control system around it. So your whole nervous system and the muscles that help to stabilize it never actually come back, or you'll develop a dysfunctional way of controlling it. You have stiffness in the segments above and below. So you never normalize what your spine should be feeling. You start to avoid specific movements. So I always think it's interesting how often I'll have somebody who comes in where they don't know how to hinge at their hips. They don't know how to squat. They don't know how to do all of these things that are just normal functional activities. And it's because their back is compromised. But then what they want is sport-specific training. It's like your sport-specific training doesn't even matter at this point. You can't do normal activity.
Yeah.
Right. And if you think of like an athletic position, that's a hinge position. Like when you're getting ready to volley a ball back, what do you call it?
Stop.
Volley a ball back? Is it called it? Because I mean, that's where volleyball.
Are we passing? Are we setting?
What is it?
Are we spiking?
No, where it gets hit over the net and you're digging it.
That's dig.
So when you're digging it, that's a hinge position, right? Like, so you're oftentimes in a hinge position or a squat position.
I think it's a combination of both if you've got good form. Yeah.
Well, and so how often does it happen where somebody can't do that? All the time.
I would hope not within my teammates or folks that I play with, but
I would put money down that not everybody on your team can hinge correctly with actually nice, good form. And it would be interesting to see how often, especially as they get later into the game, how often they start standing up higher because they're starting to feel some little stiffness or something that's uncomfortable. Mm. And that's what I mean by there's some foundational stuff that sport-specific training. I always think, well, what's the best thing for sport-specific training? Go play your sport.
Right.
Whereas when you
agree with that.
Yeah, when you do your workouts and everything, they should be targeting the problems that are make it so you can't train well. The actual sport.
Yeah.
And it's the sport-specific training. It's so dramatically overrated and not targeted towards what the person's biggest problem is. So if you have a recurring back injury and every time that you go do anything that's athletic, your back is achy afterwards, there's no sports.
You've got underlying problems.
You've got to address it. You've got to address that part first. And so that's where I think the two biggest things, can you handle your day-to-day activities? And if you can't without some back pain, that's the first thing. And then I'll say that you own the day-to-day and you don't hurt with getting done with work and everything feels fine. Now, when you're doing your workouts, you want to start to push your body a little bit higher, a little bit farther. Now it's how do you know that your tissue is handling it? I think those are the two biggest problems when people come here and they're trying to think of, well, I want to get back into shape and I want to train hard. And it seems like every time I try to, my back blows up.
And that would be like your touching of your toes for your back. Yeah. It's like trying to figure out, what many tests you can do to see kind of like where your capacity is.
It's developing your feedback loop. And the development of a feedback loop is so much more complicated than what it should be. But partially what happens is you lose your feedback. You start to feel better. Your tissue's healing. Like we were talking about with your wrist, you start to have this sensitization.
Yeah. Here's my feedback loop is I just pull on it. I mean, this is what we've developed. And it's like, is this hurting right now? Yes or no? And if it's not, okay, continue to push.
And then, but if it is, You make it better.
Then I do some traction.
Okay. And the same thing happens with the back and with the spine. So if you don't have a really clear and clean feedback loop, we call it a key sign. That's the number one thing that you want to start with. So if it's your back, I find it really easy. You touch your toes, you extend your back, you go side to side. You should feel nothing with that. It shouldn't feel painful and it shouldn't feel stiff. And if it feels either one of those, that's where you should have something to make it feel better. And we'll put some videos up of just some general ones. You can do ball over the lumbar paraspinals to help with tissue, if that's a tissue myogenic component to it. You can do lumbar traction. You can do VPAC, some of this core training stuff. And then you can also do things that reduce the tightness. So you've done them before, like hip traction or hip interrotation exercises to help with your hip interrotation, which can oftentimes drive movement through your back that you don't want, or thoracic spine mobility exercises. So we'll take videos and stuff.
Should you foam roll your low back?
Never foam roll your low back.
I see a lot of people do that.
Seriously.
Like, you told me a long time ago not to do that. And I was like, but it feels good.
A lot of people do it.
When I go to the gym, I see everybody. They're top to bottom, the whole back.
So it's so funny because I sometimes forget that I'm in a closed environment where
you haven't been to a commercial gym in a while.
No, I would freak out if somebody was foam rolling their low back. You don't foam roll the low back because if you think about the spinal architecture, your cervical spine versus your thoracic spine versus your lumbar spine, the facets in the lumbar spine are in the sagittal plane. So one of the ways that I will provoke a disc to determine what it is I will do what's called a posterior to anterior pressure. So you're on your stomach, push on your lumbar spinous process, and I basically shear the disc, right? And it hurts.
Sounds terrible.
It's terrible. Yeah. So shear sounds not fun. It's not fun if it hurts, right? So then what you want to do, so what happens when you do the foam rolling? You're shearing the disc. Yeah. So it makes no sense. And the way that I've seen, the way you should be doing it is with the muscles relaxed. So the only thing I could say is hopefully the person's muscles are firing when they're doing it, but I'm guessing they're not doing it that way. They're probably trying to target their muscle.
Yeah.
So if you do the ball on the wall, you can do one side of the paraspinals at a time and you won't be doing a provocative test actually.
And that's like a lacrosse ball, like kind of a self-massage technique.
I like lacrosse balls a lot. And if it's really sensitive, we also use these softer gel balls, work really well. I hate tennis balls because they slide everywhere.
For the older athletes, don't use a pickleball.
Do not use a pickleball. Oh my God. Those are the Theragun works well if you have a partner too.
Okay.
But you can do it too hard. So just make sure it's relatively soft. Where were we at?
I think we wanted to talk about how to get back to like full training capacity when you've got some back issues.
Yeah. So you now own your day to day. Once you own that, then it's the activity progression where you target the tissue. You need to be able to do a hinge position, a squat. You need to be able to do some level of split leg exercise like a lunge. And you be able to do that with some level of load. And the idea though is we call it the rehab standard here, but it's what you're targeting during activity progression is that you always have a good tissue response, right?
It's making you feel better.
It makes you feel better. So if your back feels worse after you're doing the exercise, there's no therapeutic benefit. And what's interesting is we see this all the time where somebody will come in from another clinic or they've been doing these exercises on their own and it hurts really bad. And then their brain, that pain's actually therapeutic. It's helpful. That's not true. So if your back hurts when you do it or it gets worse afterwards, you just overloaded the tissue capacity and you set yourself backwards.
That's not true in all instances though, just with the back.
Well, it's true in most instances, unless there's a specific thing. So for example, sometimes if you have a contracture, you may have to
go through some pain to get some mobility.
Yeah.
Okay. That's exactly what I was alluding to.
But when you're doing these exercises, especially on your spine, it should always feel better. Another way that it may present would be you start the activity and you feel tight. You should feel looser afterwards. The other problem though, during activity progression that we see a lot where you're really increasing your load is you feel fantastic during the workout. All your key signs feel really good, but then the next day you feel stiff, tight, terribly, like it feels like you get
I went through some of that with my back issues.
Well, so that means so then your feedback loop is a 12-hour loop. And you have to so when that happens, it doesn't matter that the workout went well, you reduce how much you did from time before.
Right.
And this is one of our keys is in this instant, variety is the enemy. You're not looking for a ton of different stimulus. You're looking for a few exercises.
The one or two that make it feel better.
To make it feel better for the home plan. And then when you're doing your workouts, those workouts need to be the same workouts over and over again until your tissue handles it. So during activity progression, this isn't the time where you're throwing in a whole bunch of variety. You're doing the basics really well. You're progressing your load tolerance. That's the main focus. It's not movement complexity. Right.
I know this is probably diagnosis specific, but are there specific exercises that you should be trying to load or working on when you're dealing with low back issues?
Man, that's a good question too. So we've seen a few.
Don't go deadlift 500 pounds.
Don't go dead. You know, it's funny. Often, you know, when you start to create rules for yourself as a practitioner. Okay, that didn't work well. I have had where I told somebody to go do something. I'm like, oh, we'll go return to loading, where they went and did over 300 pounds. They came back dramatically worse. And then,
like, you've got to be very prescriptive and like,
some people, that wasn't even on my radar for that to be something that person was going to go do. And then afterwards, you're like, okay, I could do this better in the future when I explained the problem.
Good self-reflection.
So what's funny is I think there's almost two ways to go about it. Some people don't handle bilateral load well. So the squat or the deadlift, they don't handle that well when they first start to come back. So in those situations, we do split leg exercises only. And then conversely, we have someone who don't handle the split leg well. They can perform the bilateral exercises easier with more control. And we have a third group. It seems that hinging is the worst, right? Like a deadlift position. Those can be huge disc loads that people don't tolerate. So it's, once again, there's this idea where there's one track fits all. That's just right there. There's three different ways that you could approach it, all the while also having a home plan that you specifically tested out to make yourself feel better. And then also there may be key signs that you need to be digging into to kind of recap that. First, have a home plan so you know what makes you feel better. Second, make sure you have key signs that you know especially as your pain starts to drop off a cliff, have things that tell you you're irritating your back. The easiest one is the touch your toes side to side, lean back. And then the third thing,
there's a song I think about.
Yeah, it's like some, what is that? The chicken dance?
I don't know.
It's one of them.
Yeah.
And then the last one is don't be afraid of exercises. Like, so if you can't get through an exercise, doesn't mean you just skip it for the rest of your life, which I have seen that. That means have you heard like that stoic thing where it's like the obstacle is the way?
Okay.
Right. So like that,
I'll trust you.
Trust me on that. If there's something that you can't do, that doesn't mean you avoid it. That you're just handicapping yourself from being able to do what you want to get back to. It means that's probably the main thing that you probably want to target, right? So if you can't do it.
Well, I think we talked about it in one of them. I was like, I hurt my back squatting, and I just went back squatting, and it ended up getting better pretty quickly.
Yeah. And honestly, if you look at most people, the natural course of most low back pain is it's going to resolve. But there is a certain population, and it depends on which study you look at, where they get dramatically worse after 3 months. And those are the people who go down like maybe a chronic pain. They become the people who have horrible back spinal pain. You have some people who it just basically stays the same. You have some where it completely resolves. And that would just naturally happen if you did nothing, right? And so if you're one of those people where it's not getting better, seek out some help.
Yeah. Were there other things that you wanted to dive into? I know that you had kind of put together quite a bit of notes on.
Well, I think that actually hit most of them. I think the biggest thing is if you're looking to make your back feel better, if you can handle those three things, and we'll put videos up for all of those.
He will.
Those home pieces. We'll do it together. I think that if you can master those, you can really increase the amount of time. Because then once you get through activity progression, once you get to where you're back to where you can hammer, nothing's hurting you. Well, then the next thing is you monitor it for when it comes back, right? And that's a periodic thing. And if you start to notice those symptoms, you don't ignore them. You immediately address them. That's why you always have the home plan that worked.
And
still have it to
slather
the back
tiger balm, slather the back and tiger balm, and that will minimize your injury risk. This is all false, but
it's not what we
but it helps
tell people.
But it helps.
Yeah, I like it.
And
I like it. No, I think that's a good place for us to hit it.
Okay.
Yeah.
Well, if you've got low back pain, drop a comment below. If you've got, don't want to get too crazy into specifics, but let us know, and Craig will do some research and try and help you out. And then aside from that, like, comment, subscribe, share, rate it high, follow,
Follow.
PYP.
PYP, baby.
All right, take care, guys.